There are now 3 confirmed cases and 1 more being investigated in Sydney's latest COVID-19 cluster. This is what we know so far. The first infection is a man from Sydney's eastern suburbs. He's a limousine driver whose work includes transporting international flight crew. He tested positive on Tuesday, which means he's been infectious since at least last Friday.
The driver's close family contacts who he had some contact with, I think there were 4 of them, have proved to be negative, and some of his work colleagues have been tested are also negative. But that's not to say we can be complacent, quite the contrary.
The second case is his wife. Between them, the pair has triggered a growing list of exposure sites. The third case is a woman in her 70s. She picked up the virus at Bell Cafe in Vaucluse, showing spread within the community. The final case is a man in his 40s from northwest Sydney. Authorities are retesting him, suspecting it could be a false positive, and he's not linked to the current outbreak. He had a low viral load, meaning it could be an old infection, so the focus is on those first 3 cases. The driver at the centre of the cluster has the highly infectious Delta variant, originally from India, and the one surging in the UK. His infection doesn't match any cases in quarantine, meaning it's unlikely to have leaked from a hotel. The strain does match one from the United States.
We always keep an open mind, because the worst thing you can have is a closed mind. The obvious hypothesis is that he's transported flight crew that have subsequently become positive, despite being negative, perhaps on the inbound.
No restrictions have been enforced, but residents in Sydney's east are advised to avoid gatherings and wear masks on public transport, while authorities figure out if there are more undetected cases.
Take it seriously. We will manage this. We will manage it again, and we'll manage it again and again and again, because I'm sure this will occur at times in the future while we're in the middle of a 1 in 100-year pandemic.
And in the last few hours, New South Wales health authorities have added 1 more exposure site to the ever-growing list. That's the Harris Farm Markets in Norton Street, Leichhardt. If anyone was there between 9:50 and 10:05 on Tuesday morning, they should get tested and self-isolate immediately. There are no new local acquired cases of COVID-19 in Victoria, with restrictions to ease further tonight. There were more than 25,000 tests yesterday. Health authorities had been concerned about a cluster of cases at an apartment complex in South Bank in Melbourne, which had grown to 8 cases.
Thanks to everybody who's coming out to get tested today. It is so important indeed that we ensure that anybody who's been to those exposure sites or who may have had contact comes forward to get tested. Over 8,000 tests were completed in the first 2 hours of this morning, which is a testament to the sheer hard work going on. We have additional testing facilities set up in South Melbourne and Port Melbourne. They're all, of course, very busy. We're also seeing good demand in the inner north, again, following some of the exposure sites in those areas.